It's one of the most common reasons people end up at the doctor. A painful, swollen lump that just seems to pop up out of nowhere. We're talking about an abscess. So in this explainer, we're going to break down what it is, how your body fights this crazy internal battle, and what it really takes to win.
I bet you've either had one of these yourself or you know someone who has. That very distinct, tender lump, well, that's the classic sign of what we're digging into today. But what is it, really?
So what is actually happening under the skin when one of these things shows up? Let's solve this mystery.
Okay, at its very core, an abscess is your body's way of trying to quarantine an infection. Think of it like a biological containment zone. It's a pocket of pus totally walled off by a brand new barrier of tissue to keep it from spreading everywhere. And what exactly is that gross stuff we call pus? Well, it's basically the aftermath of a microscopic war. It's a thick liquid made up of the fallen soldiers, your white blood cells, the enemy invaders, which are the bacteria, and all the collateral damage, which is just leftover tissue debris. The way this whole battle plays out is actually a pretty fascinating biological drama. And it all happens in 4 key steps. Let's walk through it. First, you get an invasion. Some nasty bacteria get past your defenses. Right away, your immune system sounds the alarm and sends in the cavalry, these specialized white blood cells called neutrophils. They go on the attack, but in the chaos, some of your own tissue gets destroyed, creating that liquid pus. And then, in a truly brilliant defensive move, your body builds a tough, fibrous wall all the way around the battlefield to lock the infection down. Okay, so now we know how an abscess forms, but what's actually causing it? And how can a doctor be so sure that what they're looking at really is an abscess?
Well, the number one culprit behind most abscesses is a bacterium you've probably heard of, Staphylococcus aureus. You might just know it as staph. It actually lives on our skin most of the time, just waiting for a little opportunity to sneak in. Now, while staph is the usual suspect, it's not the only player in the game. Streptococcus pyogenes is another common one. In places without much oxygen, you can find what are called anaerobes. And for patients with conditions like diabetes, it's often a whole mix of different bacteria, all working together to cause trouble.
You should also know that not all abscesses are created equal. They can be superficial, popping up on the skin as things we'd call boils, or furuncles and carbuncles. Or they can be deep, forming silently inside organs like your liver, brain, or even lungs. And those, as you can imagine, are a lot more serious. The classic signs are pretty much exactly what you'd expect from a nasty infection. The area is painful, it's red, it's swollen, and it's warm to the touch. If the infection gets bad enough, you might even spike a fever as your entire body starts to react. But among all of those signs, there is one that really stands out to a clinician. It's a sign called fluctuation. This is that unique kind of wave-like feeling of fluid moving under the skin when a doctor gently presses on the swelling. It's a dead giveaway that there's a pocket of liquid, that pus, hiding right underneath. In fact, there's a famous rule of thumb in medicine. If a doctor feels fluctuation, their very first thought is abscess. It's just that reliable of a sign.
So all the signs are there, and they're all pointing towards an abscess. What's next? Well, the next step is to confirm it for sure, and, most importantly, to treat it. For an abscess on the skin, a simple physical exam is usually all it takes. But for those deeper, hidden ones, doctors have to rely on imaging. An ultrasound is often the first tool they'll use to spot that collection of fluid. For really complex cases, a CT scan can give them a detailed map. And finally, they'll often send a sample of the pus to the lab to figure out exactly which bacteria is causing the problem. And this brings us to the absolute golden rule of managing an abscess. You can't just leave that pus sitting there. The most crucial thing to understand is this: it has to come out. The definitive treatment is a procedure called incision and drainage, or I&D for short. First, a doctor will completely numb the area. Then, they'll make a small cut to open up the abscess cavity. All of the pus gets drained out and the area is cleaned. Very often, a special gauze is packed inside that empty space to make sure it heals from the bottom up and doesn't just close up at the top and reform. Now, you're probably wondering, hey, why not just take some antibiotics? And that question gets to the very heart of why drainage is so critical. Remember that fibrous wall the body builds? Well, it's so good at walling off the infection that it also walls out the antibiotics. The drugs just can't get inside to do their job. So drainage is an absolute must. And just ignoring an abscess, that's a really, really bad idea.
If you leave it untreated, the infection can spread to the skin around it, causing cellulitis. It could even get into your bloodstream and lead to sepsis, which is life-threatening. The abscess might also try to tunnel its way out to the skin surface, or it could rupture internally, spreading that infection all over. All right, that was a lot to cover, so let's boil it all down to the 4 most important, must-remember things about an abscess. Okay, here we go. Number 1, an abscess is just a walled-off collection of pus. Number 2, the most common bug causing it is Staph aureus. Number 3, the key clinical sign a doctor is looking for is fluctuation. And number 4, the ultimate treatment isn't a pill, it's incision and drainage. If you can remember those 4 points, you've got a really solid handle on what an abscess is all about. So yeah, an abscess is painful, it's dangerous, but it's also a pretty amazing testament to the power of our own immune systems, the ability to spot a threat, send in the troops, and literally build walls to protect the rest of the body. It's a messy, violent, but ultimately protective process. It really makes you wonder, what other incredible battles are our bodies fighting for us without us even knowing it every single day?